Good morning, everyone, and welcome to the Gulf Coast South Area Health Education Center's Reach Student Programs Careers Chats. You can see from your screen that we have 6 different health career programs for our students out there in the audience. We have the Reach Health Career presentations. You can find that video on our website. You have these career chats, and there's plenty of them to choose from on our website out there to take a little look at these videos from all the different healthcare providers and see if those careers interest you. We have our Reach Health Careers summer camps, which are always a good time. I work with HOSA Future Health Professional partnerships throughout the schools. If you want to bring me in and help you prep for the regional, state, and international competitions. We have our Reach Public Health Intern Program, and then we have the big graduate level program, which is our AHEC Scholars Program. All of these student programs are absolutely free of charge, and you can see at the bottom of the screen our website for more information, my email address for more information, and my phone for more information. I am now going to turn it over to Amanda Finn. Amanda, go ahead and introduce yourself to the audience.
Hi, everyone. My name is Amanda Finn. I'm a public health student at Florida Gulf Coast University in Fort Myers, Florida. On my career path to nursing school, I am a public health intern at at Gulf Coast South AHEC. Today's guest speaker is Amber Ellers, a licensed radiation therapist who is currently working as a manager at the radiation oncology department at Avid Health Tampa. We will begin with looking at a video overview of radiation therapy careers. If you want to pull up the video, we can start that right now.
Hey, Miss Gorgeous, you ready? First thing in the morning, we come in around 6 o'clock. We warm up the machine, make sure everything is running correctly, all the energies. Our first patient will be at 7 o'clock in the morning, and every 15 minutes, we have patients throughout the day. I'm going to get you some warm blankets real quick. They have different treatments here. We have MRT, 3D, special procedures. Depending on what our patient's situation is and diagnosis is, that's what they come in for. Today's your last day. Are you excited?
Yes.
Yeah.
Yes. A couple of my daughters are coming.
Oh, her treatment is Monday through Friday, the same time every day. And once a week, we take x-ray to make sure everything is lined up perfectly and according to what is planned. I went through it with taking care of my husband, who passed away with cancer. My motivation really is trying to help them going through this hardship. You are all done. This is it. Usually they get very excited, get their family members together, and they get to hit the gong here. We have a little flag that they get to read and hit the gong 3 times just to celebrate that they have finished this journey. Sometimes a lot of our patients are scared and afraid, not knowing what to expect with their treatment. Try to explain to them, give them as much information about their treatment, let them see what's going on in the treatment room, and tell them, we are with them, because each individual treatment is different. We always try to put ourselves in their shoes.
Awesome. So radiation therapy is a healthcare field that involves a lot of high energy radiation to treat cancer and other medical conditions. Radiation therapists work with a team of healthcare professionals to develop treatment plans, administer radiation therapy, and monitor patients' progress. They use special equipment to deliver precise doses of radiation to specific areas of the body while minimalizing exposure to healthy tissue. Like other healthcare professions, they provide a lot of hands-on work with patients as well as work in a team setting. This means that they have to have efficient communication and teamwork to ensure that patients receive the best possible care and outcomes. Radiation therapy can be a challenging but rewarding career, as it provides an opportunity to help patients fight cancer and improve their quality of health. Now, Amber, we are going to be asking you some questions about your career. Answer as much as you possibly can with as much detail as you can, so that these students can have a good overview of what your career is really about. So let's start.
Yeah,
Okay.
Amber, we're looking for the good, the bad, and the ugly of the career so these students understand.
Okay. 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 So the first question is what is your job description?
So I am a licensed radiation therapist, but I also am the manager here for radiation oncology with Advent Health Tampa. Basically, I oversee the daily operations of the department. Before management, when I was a therapist, job description would be daily warm up. We would administer the radiation for every treatment for patients. We would do their CT simulations and work with nursing to make sure that weekly visits are done by the physician.
Awesome. So where do you work and what is the atmosphere like?
So I work for Advent Health Tampa, and the atmosphere here is amazing. We are a faith-based hospital, and I really enjoy that because we actually are able to connect with the patient in a different way than other organizations are. The team, the culture, everything that I could wish for is here at Advent Health.
Oh, that sounds nice. What fellow health professionals do you work with in your career?
So here we work with the medical physicist, the radiation oncologist. We have a medical dosimetrist. So between the three of them, they create the patient's plans. I work with other radiation therapists. We normally have about 4 to 5. We have our front desk people that are great. We also work with radiology, and depending if we have to put a patient to sleep during treatment, we also work with anesthesiology.
Oh, interesting. So what kind of patients do you work with in your career?
So we work with all types. They are cancer patients, some from curative to a lot of times palliative. Basically, depending on where they're at in their cancer journey, we're hoping to treat for curative intent, but some patients we're just trying to relieve their pain.
What is your typical day like?
So my typical day, starts off with warm up on the machine. We do have a patient every 15 minutes. So depending on if they're coming for treatment on our linear accelerator, we also treat HDR, which is a different type of radiation. It's more localized for breast cancer patients. And then we have our CT simulation, which patients come and get that done before their treatment. That kind of starts the process of their treatment plan. So within about a patient every 15 minutes, we're here about 8 hours a day.
Well, you already answered how many hours you work. So how many hours do you work per day and week? Does this impact your personal life?
So we work 8 hours a day, 40 hours a week, and it does not impact my personal life. If anything, it gives me satisfaction when I leave because I do enjoy what I do during the day.
That's good. So what type of starting salary can a person expect in this career?
Now, starting salary for a radiation therapist is anywhere between 65 and 70,000 a year.
Okay. So why did you decide to pursue this career?
So I got into radiation therapy because my aunt actually had breast cancer. I went with her to her radiation treatment because I always knew that I wanted to get in the medical field. I just wasn't sure if I wanted to do nursing or if I wanted to get into imaging. And when I went with her for her treatment, I realized that this is something that you could have a connection with someone. So I went and enrolled at Hillsborough Community College. They offer a program there. And that's how I got into the field.
Oh, so you started locally. That's actually really nice. What is the least satisfying about your career?
The least satisfying about my career is when we have a patient that we know that we're just treating for pain, knowing that we're not going to be able to cure them.
What is the most satisfying about your career?
The most satisfying about my career is when the patients are done with treatment and they get to ring the bell or hit the gong. So that part of their cancer journey is complete.
What education and or training was needed for your career?
So to be a radiation therapist, it's an AS degree. It's kind of like a nursing degree with 2 years. Once you complete that, then you're able to sit for your boards. You just need to get your license in radiation therapy. And with that 2-year program, you're able to enter an entry-level job as a radiation therapist.
Okay. How did you pay for your education?
So my parents, I was fortunate enough to have my parents do Florida prepaid for me when I was little. So that helped. So along with that, and then student loans, that helped me pay for my education.
Okay. So what would you like to share? Like share a story about an interesting case you worked on or a patient that you made an impact on?
So I would just say I've had many of them. I think just the stories that are the best is, this field is a little bit different from your normal medical field. We have a different connection with patients because we're with them. Some patients get 30 treatments. So, and it's Monday through Friday. So we're with some patients 6 to 8 weeks out of their journey, and we really get to connect with them on a different level compared to just having a patient come in, seeing them for the day, and then, seeing them 6 months for a follow-up. So I would say one of my favorite stories is I had a patient that got diagnosed with stage 4 cancer, and she had a son that was graduating high school. And her main focus was to get done with her treatment so she could attend his graduation. So, she came in every day. We, were there for her. We would talk with her. We'd get her through her treatments. And then when she got done with treatment, 2 months later, he had graduated. And she actually came in with her son for her next follow-up when we got to meet him. So it's really just the connection that you get with the patients. I think it's different from, another healthcare setting.
Have any of your patients made an impact on your life?
Yes, I would say that many of them do. In sense of, when you're having a bad day, you just have to remember there's people that are going through a lot worse than you are. And you have to remember, don't sweat the small stuff. So I kind of always keep that in the back of my mind. It could be worse. So you can't focus on negative things because you don't know what other people are going through.
So what is your best piece of advice for students interested in this career?
To do it. It's so rewarding. I know, especially with radiation therapy, a lot of people don't know what it is. So when you kind of look into it, it seems scary, but it's not. It's such a rewarding field, and there's such a demand for it all over. I just, if you're not in, if you want to get into healthcare and, you want to specialize, this is the field to be in.
That's great. So thank you, Amber, for being here with us today and answering all of our questions. I enjoyed hearing about your journey, and I believe this interview will give students a better understanding of what it means to be a radiation therapist. Just talking to you today really has, piqued my interest a little bit. And so I don't know, that'd be something really cool to do. But yeah, thank you.
Well, thank you.
This has been wonderful, Amber. I have the same sentiments as Amanda. I love to hear your words of wisdom, and just do it. Get out there and the don't sweat the small stuff. And most healthcare professionals, they improve lives, they save lives, but rarely are ever so close to that line as you are each and every day
Mm.
where literally their life could hang in the balance based on the radiation therapy that you provide. So it's a wonderful career that you have described to us today. And we do indeed appreciate you taking the time. I'm going to put my one pager up real quick just to remind the students that I am Joan Dixon, the Director of Student Programs at Gulf Coast South AHEC, and we have 6 different programs, all free of charge for you, so that you can explore the different and variety of health careers that are available to you. Over 300 different careers in health that are available to you. So get out there, do some research, watch all the career chat videos that we have in our library, and have a wonderful day. Thank you, Amanda. Thank you, Amanda. Thank you, Amber. I appreciate your
Thank
time.
Oh, bye-bye.
Thank you. Bye.